All right. Today, we're putting on our detective hats. We're diving into a medical mystery that loves to hide in plain sight. It's got a tricky name and a laundry list of symptoms that can throw anyone off the scent. But don't you worry, because together, we're going to follow the clues, piece together the evidence, and crack this case wide open. Let's get right into it. So let me ask you this. Have you ever had that relentless, nagging pain? You know, the one in your neck or your shoulder, maybe shooting down your arm? Or that weird tingling in your fingers that you just can't shake? If any of that sounds even vaguely familiar, well, you're already on the trail of our mystery. And here's where it gets so confusing. Look at these symptoms. Numbness, tingling, by the way, the fancy medical term for that is paresthesia, neck pain, headaches. These could be anything, right? It's so easy for this to get mistaken for something like a simple pinched nerve or maybe carpal tunnel. And that is exactly what makes this condition such a master of disguise. Okay, it's time to name our main suspect. The culprit we're hunting is called Thoracic Outlet Syndrome, or just TOS for short. And as this medical review points out, its wide constellation of clinical manifestations makes it a huge challenge to diagnose. This, right here, is the heart of the mystery we're unraveling today. So what is TOS, really? Let's boil it down. At its core, TOS is a space problem. It's a compression issue. You've got these incredibly important structures, your nerves and your blood vessels, and they are getting squeezed in a super tight little corridor in your body called the thoracic outlet. No, it turns out TOS isn't just one thing. It comes in three main flavors, and it all depends on what's getting squeezed. But look at these numbers. More than 90% of all cases are neurogenic, which means it's the nerves that are being compressed. This is what we call neurogenic thoracic outlet syndrome, or NTOS. And because it's the overwhelming majority, that's what we're going to focus on for the rest of this explainer. The absolute best way to picture what's happening in NTOS? Just think of a massive traffic jam. You've got this super highway of nerves that's supposed to run smoothly from your neck all the way down to your hand, but something is causing a major pileup and grinding everything to a halt. So let's zoom in. It's time to visit the scene of the crime. To really understand this traffic jam, we need to take a closer look at the highway itself. Okay, so that bundle of nerves we mentioned, it's called the brachial plexus, has to pass through three really narrow spots where it can get pinched. First up, you have the interscalene triangle, which is tucked in between your neck muscles. Next, it passes through the costoclavicular space, right between your collarbone and your first rib. And finally, there's the subcoracoid space, underneath your pec minor muscle. The traffic jam can happen in any one of these three choke points. And this slide lays it out perfectly. On the left, you see the open road. It's smooth sailing, everything is flowing nicely. But on the right, that's the traffic jam. See how one of those spaces has narrowed? That's the pinch point. That's the gridlock, compressing those nerves and causing all that pain and tingling we talked about. So what's causing all this chaos? Well, it could be a bunch of different things. Some people are actually born with an extra rib up in their neck, called a cervical rib, which just crowds the area from day one. For others, it's trauma, like getting whiplash in a car accident. Repetitive overhead stuff, think swimmers, baseball pitchers, can cause it too. And yeah, even something as simple as poor posture, hunching over your computer all day, can slowly but surely narrow that space over time. Okay, so if the symptoms are all over the map and the causes are so varied, how in the world does a doctor actually pinpoint this? Well, this is where the real detective work kicks in. And here's the kicker. Neurogenic TOS is what's called a diagnosis of exclusion. That means there's no single magical test that just screams, "You've got NTOS." Instead, doctors have to be methodical detectives. They have to carefully rule out all the other possible culprits before they can finally point the finger at the thoracic outlet. One of the key clues comes from something called a provocative test. It's designed to literally provoke the symptoms. A classic one is the Roost stress test. You hold your arms up in this surrender position, and then you just slowly open and close your hands for a few minutes. The whole idea is to create a temporary traffic jam on purpose. And if doing this brings on that familiar pain or tingling, that's a huge clue that you're on the right track. But doctors have a whole toolkit for this investigation. A physical exam might show some muscle wasting at the base of the thumb, a telltale sign called the Gilead-Sumner hand.
An X-ray can spot that extra cervical rib we mentioned, and this one's really clever. They can use something called an anterior scalene block. They inject a numbing agent into the neck muscles, and if that provides temporary relief, well, that's another massive clue that those muscles are part of the problem.
Okay, the detective work is done. We've identified NTOS as our culprit. The case is solved. So, now what? What's the plan? How do we clear up this traffic jam for good? And this is maybe the most important takeaway of all. For the vast majority of people, the first line of attack is not surgery. The primary focus is on conservative, non-invasive treatments. This conservative toolkit has a few key parts. There's specialized physical therapy to help strengthen the right muscles and fix your posture. Patient education is also huge, learning what movements to avoid. And sometimes, medications can help manage the symptoms while your body is healing. It's really a multi-pronged approach. So, the big question, does all this actually work? The answer is a huge, resounding yes. Get this. The research shows that about 90% of patients with NTOS get better with this kind of conservative therapy. I mean, that's an incredible success rate for such a tricky condition. Now, what about that other 10%? Well, for the small group of people who just don't get better after a few months of trying everything else, then surgery can become an option. A common procedure is a first rib resection, which basically removes the first rib to open up more space. But again, that's really reserved for the most stubborn cases.
So there you have it. We've cracked the case of neurogenic thoracic outlet syndrome. We've seen how what seems like a simple traffic jam in the body can cause this huge, confusing cascade of symptoms. And it really makes you wonder, doesn't it? If a little pinch can cause so much trouble here, where else in our bodies might similar hidden mysteries be hiding, just waiting to be solved? Something to think about. Thanks for joining me on this investigation.
Wow.